begins in 2006 in the Kolofata Health District, far north region of Cameroon. In the ophthalmology service of the Kolofata District Hospital, the healthcare team of the NGO Ophtalmo Sans Frontières notices a large number of trachoma cases presenting for consultation. Located in the Sahel, the region is poor, as many water sources run dry and remain dry for 3/4 of the year. Hygiene and living conditions deteriorate even more. The nurses undertake a preliminary study in 4 local schools. The study reveals a prevalence of active trachoma affecting over 25% of school children. In December 2006, OSF performs the first standardized prevalence study of trachoma. With a proposal accepted by the Cameroon Ministry of Public Health, Dr. Pierre Huguet, a WHO trachoma expert, is recruited to conduct the study with the assistance of a team of nurses from Ophtalmo Sans Frontières. He is accompanied by a medical biologist, Dr. Pablo Goldschmidt, who will take samples from affected patients. Dr. Ellen Eintertz, medical doctor of the Kolofata District Hospital, will also contribute to the smooth running of the study. Using the simplified coding system to record clinical findings, the nurses examined 2,394 children from 1 to 9 years old. The study reveals an elevated active trachoma prevalence of 26% among children aged 1 to 9. Given these results, the decision is made to apply the SAFE strategy, associating screening and surgery for cases of entropion trichiasis, mass treatment with antibiotics, a hygiene education campaign, and increased accessibility to water. Topical azithromycin, developed by TEA Laboratories, is chosen as the antibiotic to be used during the mass treatment campaign. A dose of 1 drop of topical azithromycin, administered morning and evening for 3 days, was proven to be an effective treatment for active trachoma in Pakistan and Guinea. TEA Laboratories agree to participate in the project and commit to provide the antibiotic at no charge and in sufficient quantity to treat the 120,000 inhabitants of the district each year and for 3 years. Parallel to the logistical organization of the campaign, posters, documents and educational materials are elaborated and distributed to inform the inhabitants and the local authorities of the different aspects of the project. In the field, numerous preparatory meetings are held not only among health professionals but also with teachers in order to pave the way for raising awareness in schools. In addition, free surgical management of entropion trichiasis patients begins at the Kolofata Hospital. The trabut technique remains the standard operative procedure. In 2008, a final prevalence study confirms the high rate, 31% of active trachoma among children 1 to 9 years old. The 120,000 inhabitants of the district are thus treated by 250 community health workers who proceed with the installation of eye drops morning and evening for 3 consecutive days, covering all the villages in 3 weeks. The distribution program was perfectly coordinated by Doctors Eintertz and Goldschmidt. Trachoma and hygiene awareness campaigns are carried out in parallel throughout the year, not only in the villages, but also in the district schools. The 2009 campaign began with a new standardized prevalence study designed to evaluate the beneficial effects of the SAFE strategy 1 year after the azithromycin eye drop treatment. The results are encouraging. The prevalence of active trachoma among children 1 to 9 years old has dropped from 31% in 2008 to 6.4% in 2009. A second antibiotic treatment campaign is undertaken among the entire population following the same procedures used during the previous year's campaign. In 2009, the smooth running of the campaign is the object of particularly close attention by the study organizers. Trained by Dr. Goldschmidt and Dr. Einters, a team of nurses are to supervise and assure the successful distribution of eye drops in all villages.
Est-ce qu'il y a eu beaucoup de refus?
Non. Au contraire, certaines des familles qui sont au Nigeria ont rejoint leur famille au Cameroun.
Ils veulent venir pour les gouttes.
Alors, je dis, bon, s'ils sont au passage, le premier passage, s'ils sont arrêtés là,
on les traite. S'ils sont là, on les traite. D'accord.
Donc on va continuer parce qu'il faut 100% de traitement. Tout le monde doit être traité, même les gens du bord. Hein. Oui, non. Les pasteurs, les gens qui sont avec les animaux. Ok, très bien. Donc on va traiter tous les gens. Ça va, madame? C'est bon les gouttes?
A hygiene awareness campaign specifically targeting girls 8 to 12 years old, the district's future mothers, is carried out and will be repeated over the coming years. For his part, Dr. Huguet focused on aspects of daily life and the local environment. Access to water remains the principal problem in the region. This problem has led to the development this year of a well construction program to be financed by both public and private funds. There is much room for other improvement as well. Soap is little used. Latrines are scarce. Animals live in too close proximity to people within concessions. It would appear that the SAFE strategy is succeeding in the Kolofata Health District in northern Cameroon. These hopeful results are the fruit of a partnership between an NGO well implanted in the country, an innovative pharmaceutical firm, and a local health service that has mastered the organization of primary health care in the district. The rendezvous is set for 2010 in Kolofata for the third trachoma treatment campaign.